Costa, you are our physiotherapist and you have been working with long COVID and other chronic illness patients for a long time. So there's a huge difference between normal people and people with chronic illness. The difference is if we move too much, we get much worse. So the therapy that you give them is of course also very different. How does it differ?
As we had some researchers, because long COVID is something new in our lives, we tried to build one protocol for these kind of clients because 90% of them, they have the same symptoms. They get tired very easy, they are very stressed, they're losing our minds, they don't know what they're doing actually.
Yeah, brain fog.
Yes. So with this protocol we create in our clinic, what we do, we try to give one cardiopulmonary exercises for the oxygen, just to increase the liters of oxygen. We use lymphatic massage. We cannot use heavy massage techniques because the tissues and the bones are very weak. As we can see, month after month, the lumbar spines gets weaker. They cannot move, mostly their legs. So with this protocol, what we try to do, our goal is to give them a better quality life, so they can move, they can do their special needs.
Does it make a huge difference if people who can't move don't move on their own and then a physiotherapist passively moves them? Does that help?
Yes, because we train the mind. So because all the movements come from the spinal cord, we try to engage all the natural human movements, walking, grab the telephone, shave, cut their hair. Mm-hmm. So it's basically education from the beginning until we can hit the goals. So,
but why can't you therapy somebody with deep tissue massage or even with Thai massage? Why is too intensive massage bad for them? Because I see you're working with the patients very carefully. You try to not overexert them and you don't try to go too deep and you do lymph drainages. Why is that working so much better for our patients than if you go intense?
Because if we go intense from the beginning, the muscles and the bones are already weak, so we don't want to damage them. Because these kind of patients, they are not on the athlete level, so we can go very deep and very heavy for their muscles. And with our massage techniques, what we try to do is to make the muscle toning, blood circulation, and etc.
What about the lymph drainage? What does that do?
It just basically sends more blood circulation on the muscles, and the way we made it, it's like the kind of what they're working out. So we give the chance to muscle to engage the blood circulation.
So you see our patients very often and then you see them on good days and bad days. So if you would describe a typical week in the life of a long COVID patient and the physiotherapy, how does that look like?
How it looks like. So, for example, if we do one session on Monday, maybe the client, there is a big chance to feel amazing the day after or 48 hours after our treatment. So the problem with these clients is that they get too excited, they overdo things, and then the next day they feel so much tired and they cannot even move for like 3, 4, 5 days. And then it's like we start from the beginning, so we have to educate them, we have to prevent them for this excitement. So
I always tell them one thing, tell me if I'm right. I tell them 1/3 of the new energy you get from the treatments, invest them into new activity. 2/3 invest them into recovery and into pacing and being quiet. Is that a good advice?
It's very good advice. Because for me personally, the best therapy is the prevention and the education. We have to give them tips because this type of people, I mean, they have their jobs, they know more of their topics. So our job is also to educate these people, giving them advices and
But it's difficult because sometimes you tell them and a week later they already forgot. Well, it might seem like they don't listen.
That's why I said education, week by week. We have to keep reminding them things. And the most important thing, for specific things they want to do, we have to give them the permission to do a few things. Like, for example, go for a hiking in the mountains, which the oxygen is less on the mountain and more next to the beach.
So what we have observed is that athletes are hit very often more strong by long COVID. What's the reason for that?
The reason for that, so we start from the heart. The heart is a big muscle. It's getting bigger, especially for elite athletes because they work on a high level base. And after the long COVID, they spend lots of time to get back to their elite levels. They consume less oxygen now. And also with physiotherapy, rehab exercising. The last patient we had, she was a marathon athlete. She was struggling to even run for 5-6 minutes. The feedbacks now are better and better, month per month. So for an athlete, the rehab state is harder for a normal client.
Like, for example, I was not a pro athlete at the time that I got long COVID, and you've been treating me for the last 2 years. What would happen to, for example, my back if I would stop getting physiotherapy?
You will get more and more back pain episodes. You know, you couldn't move on. You will spend more time on the bed, making few steps, and then back to the bed. Your upper body will drop down.
Okay, enough said. I think we're going to have a massage again, my friend. Let's do that right now. And thank you very much for your time and a nice interview. Thank you, Costas.